After new COVID-19 cases rise in Europe, top health officials expect increases in the U.S. too. And one expert says it is time to prepare right now. Mandy Gaither has the latest on what's going on with the Omicron subvariant.
In the UK, new COVID-19 cases are climbing once again, driven largely by the Omicron BA.2 subvariant. And top health officials say what happens there tends to play out here in the U.S. about 2 to 3 weeks later.
We better pay close attention to what's going on there.
Dr. Anthony Fauci says the U.S. will likely see an uptick in cases, but not a surge, as BA.2 is more contagious than the original Omicron variant. But right now, Fauci says it doesn't seem to be the cause of the UK's rise in hospitalizations.
It's a very interesting situation where the cases are going up, but it does not at this point in time appear to be any degree of severity.
Fauci says BA.2 may become the dominant variant in the U.S. today. The CDC said it was the cause of nearly 35% of new COVID-19 infections in the past week, up from about 22% the week before. Fauci cautions the U.S. needs to be prepared for the possibility of another variant in the future. That means building up supplies of antivirals and tests and vaccinations.
We can't just say we're done. Now we're going to move on. We've got to be able to be flexible.
Meanwhile, FDA vaccine advisors are scheduled to meet on April 6th to discuss the possible need for COVID-19 booster shots in the future and whether the vaccine could become an annual shot similar to flu shots. For Health Minute, I'm Mandy Gaither.
The CDC says a growing share of sewage systems in the U.S. have detected increased levels of coronavirus in recent weeks. Nearly 40% of wastewater sampling sites with recent data reported at least some level of increase over the past 15 days. Now, that's more than twice the share from just a month ago.